Hello everyone, this is the Mental Health for Life channel. So, what exactly is depression? It's that feeling of being down, heavy, sad, lonely or empty. Everyone feels this way when things aren't going as planned, or when we lose something important. It's actually a normal emotional response. But when depression gets worse, it affects your motivation and actions, making it hard to do everyday tasks. If it starts impacting your daily life, then it's considered a mental health issue. But, is it really depression? Not always. The reason is that nearly every mental health condition begins with depression, which means there could be other possible causes. To diagnose depression using the ICD-11, International Classification of Diseases, doctors check for three main symptoms. First, a low mood and loss of interest or pleasure in things you usually enjoy. Second, issues with concentration, negative thoughts like I'm worthless or the future looks bleak. Third, physical symptoms like insomnia, loss of appetite, and extreme fatigue, which are signs of autonomic nervous system imbalance. If these symptoms last most of the day for over 2 weeks and you can't get back to your usual routine, it's likely depression. But, if your depression doesn't meet this criteria, or other symptoms show up, it could be something else. So what are some of these other conditions that start with depression? Let's dive into 11 of them. Number 1. Dysthymia, or persistent depressive disorder. If depression improves within 2 weeks, it's just a normal reaction. But, if it lasts longer than that and you're still unable to function, it might be a mental health condition. If you've experienced a mild form of depression since you were young, it could be something called dysthymia. This can develop into major depression or bipolar disorder, so it's important to get treatment. Number 2. Grief response, or bereavement reaction. Loss of a loved one, whether through death, breakup, or job loss, can trigger depression, especially when grieving the death of a loved one or pet. It's known as grief response, or bereavement reaction. It's normal for this to last about 2 months, but if it continues beyond that and you're unable to get back to normal life, it could be complicated grief. Number 3. Adjustment disorder. Sometimes, stress from things like harassment, excessive work, family problems, or financial issues can lead to mild depression or anxiety. This is called adjustment disorder. If the stressor goes away, symptoms usually improve within 6 months. However, when stress lasts for years, like in cases where someone can't leave a job or is being bullied, this can turn into chronic adjustment disorder, which is often mistaken for depression. Number 4. Physical illness. Conditions like stroke, brain tumors, or endocrine disorders can affect brain function and lead to depression. Also, medications like blood pressure drugs, birth control pills, antiviral drugs, or steroids can have depression as a side effect. If you start feeling depressed after taking a new medication or during treatment, talk to your doctor. Number 5. Depression related to menstruation or childbirth. Hormonal changes in women are strongly linked to depression. Many women experience depression before or during their period. But if it severely affects daily life, it might be premenstrual dysphoric disorder. After childbirth, some mothers experience mood swings, and if it lasts more than 2 weeks, it's considered postpartum depression. As women approach menopause, declining estrogen levels can cause symptoms like hot flashes, dizziness, fatigue, headaches, joint pain, and depression, which is sometimes diagnosed as menopausal depression. Number 6. Bipolar disorder. One condition often mistaken for depression is bipolar disorder. It involves both depressive episodes and periods of high mood, known as mania. It used to be called manic depressive illness. Many cases of bipolar disorder start with depression. Sometimes antidepressants don't work as expected and might even trigger manic episodes. Often, people who are diagnosed with depression later find out that they actually have bipolar disorder. Number 7. Schizophrenia. If you feel like you're being harassed or overhear people talking behind your back when no one's there, you might be experiencing schizophrenia. It's not just in your head. You actually hear voices and experience delusions. This can lead to depression, but it's not the same as major depressive disorder. Number 8. ADHD. Some people struggle with constant mistakes and failures at work due to inattention, leading them to feel depressed. This might be a sign of ADHD, a developmental disorder. People with ADHD often have a history of being late or forgetful as kids, and they may have been labeled as careless or restless. Number 9. Autism Spectrum Disorder, or ASD. Trouble with social relationships is a major cause of depression. If you have difficulty understanding others' feelings or reading social cues, it could be a sign of Autism Spectrum Disorder, or ASD. People with ASD tend to be very focused on routines and procedures. Number 10. Borderline Personality Disorder. When someone gets overly anxious about being rejected or abandoned, especially in close relationships, it might lead to depression. This condition is known as borderline personality disorder. People with this disorder may constantly need to stay in touch with others, often testing their partner's feelings. Sometimes, when faced with a breakup, they may resort to self-harm or even suicide attempts. Number 11. Anxiety disorders and OCD. Feelings of anxiety, fear, and loneliness often overlap with depression. It can be hard for some people to distinguish their feelings. If anxiety is the dominant emotion, it may be anxiety disorder. There are different types. Panic disorder involves sudden attacks of fear. Agoraphobia causes anxiety in places where you feel trapped, like crowded areas or public transport. And social anxiety disorder is when you feel nervous in social situations. Obsessive-compulsive disorder, or OCD, is when negative thoughts and images cause anxiety, leading to compulsive behaviors like checking or washing rituals. Just like how a cold or cancer starts with physical symptoms, most mental health conditions also start with depression. Depression is often the first sign of many mental health issues. The key is to address it early, no matter what the cause, before it becomes a bigger problem. If you feel depressed, take a moment to review your current environment and life, and if needed, consult a professional. That's it for today from the Mental Health for Life channel. If you found this video helpful, please subscribe to our channel and give us a thumbs up. Thank you for watching. I hope you found the content valuable, and I'll see you again next time.